Hello everyone. So today we will be discussing the NAC OSCE approach to attention deficit hyperactivity disorder, that is ADHD. I'm Dr. Mayowa Apata, and this presentation is for educational purposes only. So by way of introduction, ADHD is one of the most common behavioral problems in childhood. It's described as a condition that can make it difficult to sit still, pay attention, or make good decisions, and it occurs more in boys than girls. So for the diagnosis, it occurs before the age of 12, six or more signs of inattention or hyperactivity, then persistent symptoms that occurs more than 6 months, then occurs in greater than two settings, or it could occur in just two settings. And there is significant impairment in a social setting and or at school. So for some of the symptoms of inattention, they include failure to give close attention, and then the child has difficulties sustaining attention. While some of the symptoms of hyperactivity include the child often fidgets with hands or feet, and there's difficulty playing quietly. So this slide highlights the candidate's instruction. So this is a case of an 8-year-old male with 1 year history of angry outbursts, both in school and at home. Then the mother also complains that he is always restless. His teacher reports that he regularly interrupts his classmates. So in the next few minutes, we are expected to obtain a focused and relevant history of the presenting problem. Then we are also asked to address the mother's concern. So we should take note that the child will not be present, only the parents will relate the story. So this is the outline of our history. We want to identify the chief complaints. We also want to know the history of the presenting illness. So we would like to identify the timeline. Then that includes the onset of symptoms. Then if there has been any recent events, that includes any domestic violence, or any death. We also want to identify his schooling activities. That include if there has been any learning problems noticed by the teachers or any special educational resources. Then we ask questions about his performance at school. That includes his best and worst subjects, its mood, if there has been any issue of absenteeism. Then we want to ask questions about multiple settings, if, if the symptoms occur at home, at school, or even maybe on the playground. They want to ask questions about the child's behavior. Next, we ask, still on the history of presenting illness, we ask questions about history of attention, history of hyperactivity. We want to ask questions about the developmental history of the child. Then, very important, we want to ask questions about presence of red flags. We want to rule out red flags like child abuse, any history of neonatal complication, any family history, or recent onset. Then regarding the past medical history, we want to ask questions about the prenatal history, especially the prenatal care that the mother received. Then any history of maternal illness. Then for the perinatal history, we want to ask questions if there is any issue of birth asphyxia, any issue of prematurity. Then for the postnatal history, we want to ask questions about the neonatal complications, and then any history of NICU admission, that is the neonatal intensive care unit admission. Then for past surgical history, we want to know if the patient has had any surgeries in the past. For medication history, we want to know the medications that the patient is on, if the patient is on any. They want to ask questions about history of allergies, especially to medications, to food, or to the environment. They want to ask questions about the immunization history. We like to know if the patient's immunization is up to date. We want to take history on the family. If there's any family history of ADHD, any history of autism or deafness. Then we also want to ask questions about the social history. We want to understand the marital status of the parents. Then we also want to identify their financial states, the health plan, if there's any effect of illness on the family. And still on this social history, we want to identify the psychosocial situation. If there's any issue of adoption, parental neglect, or abuse. Then moving on, we like to identify the developmental history. That include the age of developmental milestone, the gross motor skills, when compared to peers, the abilities to perform daily tasks. Then we go through the review of systems, which includes the nutrition, the sleep habits. Then we also identify any risk factors like prematurity, perinatal asphyxia, genetic abnormality, or any issue of chronic illness. So while taking our history, we must rule out other causes, that is the organic causes, which include the neurologic causes, the sensory causes, and the medical condition causing chronic fatigue. We also want to rule out the cognitive causes like learning disorder, developmental delay. We want to highlight the behavioral causes like oppositional defiance disorder and conduct disorder. We also want to rule out any environmental causes or medication or drug causes. Then the mom would like to know like how is ADHD treated? The treatment is broadly divided into two. We have the non-pharmacologic treatment and the pharmacologic treatment. So for the non-pharmacologic treatment, it includes behavioral treatment. That is, with behavioral treatment, we can improve the child's behavior by making changes at home. For instance, that includes that we can make a checklist for the child to use every morning so that the child can remember what to do. And we can also make changes at school. We can let the teacher make changes in the classroom to make the child do better in school. For example, the patient can be given like a note to write down the homework so that the child does not forget. Then we also want to engage the child in social skills training. And for the pharmacological treatments, that include the use of stimulants and the use of non-stimulant medications. Thank you, and I wish you success in your NAC OSCE exam.